Welcome everyone to Fundamentals, Chapter 22, Infection Control. Infectious diseases are contagious or communicable diseases. They are also community acquired infections. These diseases are persistent. Currently, our health problems are AIDS, HIV, and SARS. The infection process has a chain of infection. As you see here with this diagram, we have the infectious agent. We must have a reservoir, a portal of exit, a transmission mode such as contact, droplet, airborne, a portal of entry, and a host. An infection is a condition that results when microorganisms cause injury to a host. Colonization is a condition that exists when microorganisms are present, but the host does not manifest any signs or symptoms of infection. Active treatment is not normally necessary, but the microorganism is capable of causing infection if favorable circumstances exist. Then we have the progress of infection is through distinct stages. Here we have the 5 stages of the infectious disease process. The incubation period is that period of time where the agent reproduces, but there are no recognizable signs or symptoms at this time. The immune system has not been overcome by the organism as of yet, and the blood levels of the organism is still relatively low, but they are rising. When you get to stage 3, you see that is the acute stage, so that is at the peak of the infection. Once the infection has peaked, after a period of time, you start to see a decline in which the patient gets better. Their white count improves, their temperature starts to go down, their vital signs become a little bit more regulated. And then you have the convalescent phase, which is the time of healing that occurs after the infectious process. Well, let's start by talking about types of pathogens. Here is an example of a fungal infection known as thrush. As you see, it's a white coat that appears on the tongue. We give certain medications that will help combat that fungal infection. It can be a result of antibiotic usage, or it can be related to the underlying disease process. Another pathogen is prion. An example of prion is mad cow disease. We don't see that here in this country, but it has been in Europe in the past. In the late 80s, early 90s, they did have some mad cow disease, which is a prion. Our next pathogens is bacterial or viral, or sometimes can it be both? So occasionally you'll have strep throat, tuberculosis, whooping cough, also known as pertussis, UTIs. This is a bacterial infection. It requires antibiotics. Then you have your viral infections. And a virus is the common cold, the flu, or sore throat. These do not require antibiotics. They just have to run their course. Now, occasionally, you have a combination of both viral and bacterial. You may see this in bronchitis, some ear infections, and some sinus infections. Depending on the practitioner, the severity of symptoms, and the patient's tolerance of the pathogen, you may or may not need antibiotics. Another pathogen are parasites. Now, we rarely see parasites in our country, but occasionally we do have roundworms, some flukes, and protozoans. A lot just depends on the country, or if you're traveling overseas, you may be exposed to some parasites. So we have some immune defenses already in place. Nonspecific immunity, which is our native immunity, can be a passive type, an external source of antibodies. We can have temporary immunity that does not have memory of a past exposure. We also have skin, that's a defense. Our skin is intact, it's in one piece, we don't have any breakdown, no lesions or wounds. That is a defense mechanism. Our mucous membranes, secretions, those type of enzymes, that is a protective, that is an immune defense. And then we have our inflammatory response, which is the way our bodies defend against a disease process. Now, we also have some specific or adaptive immunities, and such as an active immunity, which requires time to react to the antigen. And that can be a permanent immunity as well. We also have B cells and T cells, and we have specific antibodies against specific antigens. Now, later on in MedSurg 1, you're going to learn more about passive and active immune responses. So, infection control precautions are physical measures designed to curtail the spread of infectious disease. And the most important and the most formidable measure that we can take is hand washing. Hand washing before leaving the client's room and before touching any other client, personnel, environmental surfaces, or client care item. You must wash your hands. That is our first and foremost important action that we can take to stop the spread of infectious disease. Healthcare personnel follow standard precautions whenever there is the potential for contact with the client's blood, body fluids except sweat, regardless of whether they contain visible blood, non-intact skin, and mucous membranes. Standard precautions are measures for reducing the risk of microorganism transmission from both recognized and unrecognized sources of infections. The CDC has 3 standard precautions for infection control which address respiratory hygiene, cough etiquette, safe injection practices, and practice for special lumbar puncture procedures. These particular precautions do not address surgery, endoscopes, or room sharing. So, for the respiratory hygiene and cough etiquette, you need to teach the patient to cough or sneeze at the inside of their elbow, throw away tissues, wash their hands immediately. For injection safety, we're talking about using safety needles and deploying that safety cap whenever after you give the injection and immediately placing it into the sharps container. As far as the spinal injections, the physician performing the lumbar puncture and the nurse assisting should both wear masks during the spinal puncture. So standard precaution is a tier 1 protection. We move to tier 2, which is droplet. So with droplet precautions, you need to be more than 3 feet away from the patient. If you are closer than 3 feet, you need to have on a mask. The patient's door can be opened or closed. With droplet precautions, these droplets commonly exit the body during coughing, sneezing, talking, and procedures such as airway suctioning and bronchoscopies. So during these type of procedures or with these types of patients, you need to wear a mask, and a regular surgical mask or that type of mask is fine for droplet precautions. So our tier 3 is your airborne transmission. This requires a negative pressure room. You have to have a specially vented room for that. The door has to stay closed at all times, and you are required to wear an N95 mask when entering this patient's room. So let's start with contact precautions. A person on contact precautions, as the nurse, you have to wear gloves and gown with this patient. You need to minimize the risk of transmission during transport. Use exclusive equipment such as disposable thermometers, blood pressure cuffs, stethoscopes. Clean equipment between each client. Sometimes the contact precaution may require a positive airflow room as well as a HEPA filter, and depending on the contact, you may be required to wear a mask. Here is an example of airborne versus contact infections. As you see, we have tuberculosis, measles, chickenpox, SARS. SARS can sometimes require both contact and airborne precautions, just like some of the chickenpox can be both airborne and contact precautions. So know that sometimes with certain disease processes, you may need to use both types of precaution, airborne and contact, depending on the disease process. So there are some risk factors associated with infections: poor hand hygiene, compromised health defenses, improper use of medical or surgical asepsis, such as an indwelling Foley. So if a Foley catheter is placed on the bed and you have backflow into the bladder, that can cause an infection. If asepsis was broken during the insertion of that Foley catheter, that can cause an infection as well. Poor personal hygiene and nutrition, heavy smokers, alcohol abuse. ETOH is alcohol abuse. Stress can even be a risk factor. Crowded living environments. That's why you see so much about the meningitis vaccine for college students, because of the crowded living environments. Poor lifestyle choices such as IV drug use, sharing dirty needles, and unprotected sex. Exposure such as poor sanitation, mosquito and parasite infected areas. So if you travel outside of the country, you could be at risk for infections there. And if you travel to a place where there is an endemic going on, that could put you at risk as well. An example of a compromised health benefit could be someone who is receiving chemotherapy, someone who's had a kidney transplant, lung transplant, someone who's had a transplant. Those are people who with compromised health defenses, and so that puts them at risk for certain types of infectious processes. Know that you have PPE, you have to foam in, foam out, always washing your hands. If you are working with a client who is positive for C. difficile, soap and water is what you have to use. You cannot use foam or alcohol-based cleansers for that. Know that if you're obtaining a stool specimen or a urine specimen, that once you've obtained those specimens, that and the testing is complete, that specimen is going to be flushed or thrown away, incinerated, and all that's going to take place after the testing is complete. But know that whenever you are obtaining those specimens, that you are using good PPE, that you are washing your hands, that you've got your gloves on, that you're wearing your gown, that you're taking all the precautions you can when you're getting that stool specimen or that urine specimen or that sputum specimen, even a wound culture. Be very cautious on how you're doing that, and know that once that testing is complete, the leftover specimen is going to be flushed or incinerated. So what does a patient with an infection look like? Well, they're going to have a fever. Yes, their temperature is going to be elevated. They may complain of chills. Their heart rate and respiratory rate are going to be elevated. They're going to be fatigued. They may have loss of appetite. They could have some cramping or diarrhea, and of course some large lymph nodes. You can also have localized infections, like from a wound. If you have that, the wound's going to be red, warm to touch. You may have edema and pain, tenderness, even loss of use. You may have some exudate present, some drainage. So those are the kind of things you may have with an expected infection for your patient. Here is a localized infection, a localized inflammation, what you would see with that infected area: heat, swelling, pain, tenderness, and this is just what it would look like in the skin and the capillary area over time. So how do we treat an infection? We're going to use antipyretics such as Tylenol or aspirin. We're going to have antimicrobials. We're going to have, and the antimicrobials are going to treat those microorganisms, the bacteria and the fungus, viruses, protozoans. They're going to kill the pathogen and prevent growth of new pathogens. So that's what the antibiotics are going to be for. Now we have what's called acquired healthcare setting infections. So these are the infections that we want to prevent when patients are in the hospital. This is why it's so important to use that sterile technique when you're putting that Foley catheter in. And this is why it's so important to wash your hands when you leave in a patient's room and before you start a new procedure. So you see a lot of these infections, hospital-acquired infections, in intensive care units. Lots of time it's from ineffective hand washing. Common sites of these hospital-acquired infections are urinary tract, surgical wounds, respiratory, and bloodstreams. The most common organisms are E. coli, staph. These are the most common organisms that we see in the hospital-acquired infections. We have infections that are known as multi-drug-resistant infections. MRSA is one of those. Commonly it's treated with vancomycin. But then we also have what's called VRSA, which is your vancomycin resistant staph. And you treat that just specific to the patient. You may have to use a variety of antibiotics for that. With both of these patients, they're going to be on contact precautions. So there are many microorganisms that cause tuberculosis, gonorrhea, and some forms of wounds and respiratory infections. And some of these have led to multi-drug resistant strains. So with these multi-drug resistant strains of infections, we just have to be client specific and just treat them on a client to client basis. It's just going to vary depending on the patient. Long-term care residents and elderly hospitalized clients are at risk for antibiotic resistant infections, so just be aware of that. They are more susceptible to pneumonia, influenza, urinary tract and skin infections, as well as TB. And that's especially in your long-term care clients in those facilities, those nursing home patients. Shingles is a form of herpes zoster. It can be risk factors can be a current illness, stress, immune compromise, or poor nutrition. We're just going to give analgesics and antivirals for that. You're going to place the patient on isolation. Depending on what type of chickenpox or the shingles they have, it's going to be on isolation. Use wound precautions. Avoid exposure to infants and pregnant women. So if you are childbearing, if you're actually pregnant and your patient has shingles, you don't need to take care of that patient. Findings with shingles can be paresthesia, pain, unilateral rash, which means the rash is on one side of the body, and they have a low-grade fever. Here's just an example of the shingles and what they may look like. They look like little pustules that occur on the body. Like I said, it's on one side of the body. It's unilateral. Now more than ever, you need to be diligent in your use of PPE. The cover gown that you wear, make sure that it is close fitting at the around your waist. Make sure it's tied securely. Make sure that the wristbands fit adequately, that it's very tight, covering up your arms. Make sure that they're not loose. If you see a coworker and their gown is loose, tied up for them, make sure that it's tight. Make sure that you are using your face protective wear. Make sure that that fits properly. If you're wearing an N95 mask, that has to be specially fitted for you to use an N95 mask. Make sure that you are wearing gloves. And make sure that you are disposing of contaminated linen and equipment and supplies. So you may have to double bag that equipment or double bag some of that trash whenever you are taking it out, and make sure that you are going in and out of those control rooms, those contact rooms, very carefully, and that you're being mindful of washing your hands and disposing of your PPE. Make sure that you're taking the dirtiest PPE off first. So usually you're going to take those gloves off first and then work your way up and take the mask off last by just grabbing that at the ear loops and pulling it off. Don't grab it by the front, grab it by the ear loops and pull it off. But just make sure that you are very diligent in using your PPE always, and now more than ever. So when you have a patient on isolation precaution, you need to be very attentive to their needs. Know that they are at risk for social isolation and sensory deprivation as well. So you want to spend some time with the client, maybe open the curtain so they can see outside, ask them if they'd like the TV on, spend a little time with the patient. Know that they may not have visitors because that they're on isolation. In the client environment, make sure that you're familiar with the infection control room. Some of them have inner room and outer rooms that you can go into, so be familiar with those type of rooms. For your equipment and supplies, try to use disposable equipment when able. You want to use as much disposable as possible because you don't want to move equipment from one room to another. Be mindful of discarding biodegradable trash. So if it goes in the biohazard bag, make sure it's like blood, urine, Urine can be flushed, but it can also go in the biohazard bag. Blood can go in the biohazard bag. Be very mindful of your biohazard usage in the room and use it to its fullest extent. When you're delivering specimens to the lab, be sure to use the proper container for that. If it belongs in a bag, put it in a bag. If you are transporting a client with an infectious disease, be sure that that client is wearing a mask. If you have to wear an N95 mask when you go into that client's room, that client has to wear an N95 mask when they go down to radiology, when they go over to the cath lab, when they go down to x-ray. Make sure that they have on their proper PPE as well. So sometimes infections can be transmitted through equipment such as indwelling Foley catheters, humidifiers, incisional sites that have intravenous tubing, TPN, which is a type of IV food or an IV nutrition we give patients. Infections or bacteria can grow inside that TPN, so that has to be changed every 24 hours. Tube feeding, so that tube feeding bag has to be changed on a regular basis. So be mindful of that equipment that's being used. How often does it have to be changed? Because you want to reduce the chance of infection, reduce those risks of infection with the use of that type of equipment. Our geriatric population is susceptible to infections because they have a decreased immune system, so we need to make sure that they have proper nutrition and proper fluid intake. Know that their signs and symptoms of infection are much subtler and may take a little bit longer to recognize, so you have to be very in tune to the signs and symptoms of infection in an older person. But once the infection takes hold, it can be a very rapid course and become very life-threatening to the older population. You may notice change in their mental status or in their behavior, and that can be a sign of an infectious process. There is a high incidence of TB in those long-term care facilities, so just be mindful of that. Maintaining closed skin. That skin needs to be intact. So anytime a patient has skin breakdown, that puts them at risk for an infection. That's why it's so important that you turn your patient every couple of hours, that you do a skin assessment at the beginning of your shift and throughout the day. And of course, proper perineal hygiene to prevent those urinary tract infections. If the patient can get up and get on the toilet to void, that's most desirable as opposed to a bedpan or a Foley catheter. So just be mindful that the older population is more susceptible to infections than our younger population is. And that concludes our discussion and the lecture for Infection Control for Fundamentals, Chapter 22.